afternoon, everybody, and thank you so much for joining us today for the webinar titled Mental Health in the Workplace, Prevention, Early Intervention, and Employee Assistance Programs. My name is Marie Stuckey, and I am the Member Relations Specialist here at the Maine Health Management Coalition. So I'm going to start by just giving you a little bit of background about the coalition. For those of you who are not currently members, so you understand who we are. The Maine Health Management Coalition is a purchaser-led partnership among multiple stakeholders working collaboratively to improve health and maximize the value of healthcare services for the employees and dependents of Maine Health Management Coalition members and all residents of the state of Maine. We have over 60 members comprised of different stakeholders such as consumer groups, purchasers, health plans, brokers, providers, and affiliates. And working together with everybody is really key because everybody has a different perspective in solving our healthcare problems. We accomplish our work in a variety of ways, and the foundation for all of this is through our data department, which uses an all-payer statewide claims database to understand your healthcare spend. We also accomplish our goals through transparency and public reporting. We report outcome safety, patient experience, and cost ratings for a variety of services on our consumer website, Get Better Maine. And we encourage you to check out Get Better Maine and direct your employees to this site so that they can get the highest quality providers to help improve health and productivity. The Maine Health Management Coalition also works on consumer engagement. We engage employees and communities in their role in system and care improvement, including personal responsibility for health, choosing quality and appropriate utilization of services. We are also working on a benefit design with all the health plans in the state to identify key patient and provider benefit and reimbursement incentives that reward the use of coordinated, appropriate, high-quality, patient-centered care. You can check out the value-based insurance design plan on our website if you go to member resources. Our website address is mehmc.org, and then go to member resources, archived webinars and presentations, and you can see a presentation on the value-based insurance design plan there. Finally, we work with our members on payment reform, exploring alternative payment arrangements with providers, hospitals, and systems. So I want to keep you apprised of some important upcoming webinars. The May 20th webinar, I actually think it's May 13th, that slide may need correction, is integrating health into productivity business strategies to lower costs and compensation claims, and registration is currently open for that. And then in June, we'll be bringing you patient employee engagement toolbox resources to evaluate healthcare services and choices. You can pencil in on your calendars September 16th for our annual symposium. This is a great opportunity to network and learn about all the different things happening in the state. We will be opening registration for that event soon. And we also offer other opportunities for involvement, such as work groups and committees. Our members receive wellness newsletters and member newsletters, and we offer value-based insurance design training and evidence-based medical policy training for policymakers. This is just a real quick slide of our current membership, but you can see this on our website as well. So if you have some interest in joining the Maine Health Management Coalition as a member, or any questions about the benefits of membership, feel free to contact me through any of the information at the bottom of the screen there. I'd be happy to talk to you about that. So without any further ado, let me just give you some brief information about logistics. We are taping this today, so you can always reference it back on our website. At the bottom of your screen, there's a chat box. Please feel free at any point during the webinar to type questions in there, and at the end of the presentation, after all our speakers are done, we will do a question and answer session. So I'd like to introduce our first speaker, Sheila Thibodeau. Sheila earned her MSW from the University of Maine at Orono and is licensed as a clinical social worker in Maine. She has over 15 years of experience as a counselor and provides management HR consultations, training, critical incident responses, and direct service to clients. Sheila is the Director of Operations at Workforce Performance Solutions, a leading provider of consultations, training, full-service employee assistance programs, and SAP services. So with that, I am going to pass over the controls, and thank you for joining us, Sheila.
Thank you. Well, thank you very much for having me. I appreciate the opportunity to talk with all of you. First, I thought that I might do a brief outline of what the topics I'll be discussing today very briefly. I'll be looking at a couple of different definitions related to mental illness as well as substance abuse, a few statistics around that. Yeah.
Sheila, I'm sorry to interrupt you. We just need you to get your slides up because we're not seeing your slides just yet. There we go.
Okay.
Here they come. Okay, there we go. Sorry about that. We've got your slides now. Go ahead.
Okay. So the other areas that I will touch upon briefly will include what our role is, some signs of impairment, having effective conversations, and certainly what our role is not, some things to be cautious about, and just some of the things that we know that work. So are my slides all set?
Yes, you're doing fine. We can see your slides.
Great. So we'll start off with the definition related to mental illness. So mental illness is defined as collectively all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood, or behavior, or some combination of those associated with distress and or impaired functioning. According to the World Health Organization, mental illness accounts for more disability in developed countries than any other group of illnesses. This includes physical illnesses such as cancer and heart disease. We also know that about 1 in 4 individuals will suffer from mental illness. Depression is the most common type of mental illness, affecting about more than 26% of our U.S. adult population, so pretty significant statistics. And also we know that nearly half of all long-term sickness absences are caused by mental health problems. It's also estimated that by the year of 2020, depression will be the second leading cause of disability throughout the world. So pretty staggering. In a 3-month period, patients with depression miss an average of 4.8 work days and suffer 11.5 days of reduced productivity. Pretty significant for not only employees, employers, and our economy, of course. Significantly greater percentages of lifetime depression has been reported among women at about 11.7% than men at about 5.6%. This is, research shows that this is due to a combination of things, including biological, genetic, and psychosocial factors as well. So take a brief look at substance abuse. Substance abuse is a harmful pattern of the use of any substance for mood-altering purposes, which lead to frequent and serious problems. These problems can impact performance at school, work, or at home. 75% of illicit drug users work. 62% are employed full-time. So if we really think about that among the folks that we work with and with our employers, it's pretty significant. More than 60% of adults know someone who has reported to work under the influence of alcohol and other drugs. Alcohol and drug abuse have been estimated to cost American businesses roughly $81 billion in lost productivity each year. And alcoholism is estimated to cost 500 million lost workdays annually. There are there's a list of industries with the highest illicit drug use. At the top of that list, going down, is food prep and service, construction, arts, design, entertainment, sports media, sales and related occupations, transportation. So the impact of substance abuse and mental illness on organizations, there are several ways that they're impacted. Here are a few. Presenteeism, really attending work while sick. And of course, turnover is extremely costly for organizations. An increase in absenteeism, lost profitability, productivity, and safety. There's an increase in job-related injury, an increase in raising accident rates, which causes substantial consequences for employers. So what is my role? So what we really want to do is focus on job performance and safety. We must identify and address job performance issues timely and directly. We must address safety at all levels. Whenever we're thinking about it, we need to look at from the employee perspective, from our team perspective, patients, customers, employees as a whole. We also want to balance sensitivity and performance. So we want to make sure that we're paying attention to a performance and offering the information that we need related to that, but we want to do it with compassion as well. We want to be supportive while holding employees accountable. Obviously, employees still need to be able to do job functions and perform those functions. But if we're not addressing the issues that we really need to be, this really impacts the entire team. It's not uncommon through EAP for us to get information. If things are not being addressed appropriately, we'll get the call from typically other employees who are trying to figure out how to manage the situation. So continuing on, having effective conversations with employees is critically important. It's interesting, we're not generally taught how to do this, and it's very difficult to do. Often managers and supervisors are promoted on technical skill, but we really have not developed the opportunity to develop more of the EQ skills that we've been hearing about so much about over the last few years, encouraging the development of emotional intelligence. Managing stressed out, angry, emotional workers can be extremely challenging, and oftentimes it doesn't come naturally to us, and oftentimes we haven't had the training. So what we really want to do is provide an opportunity to teach people to have the ability to appropriately respond to others' emotions and reactions. So if you think about that in the moment, in the middle of an intense conversation potentially with an employee, what we're really asking people to do is to appropriately respond to other people's emotions, to also understand and manage our own reactions in that moment, and to communicate effectively while both of those things are going on. So navigating all that can be pretty intense, and certainly can be learned, and we get better with practice. So also we want to honor confidentiality, be honest, fair, consistent, and respectful, be clear about our policy with employees. You'll hear a couple of these come up repeatedly. It's extremely important that we know our policy, and also we're able to explain that policy to employees. We want to specifically address job performance issues, encourage improvement, and pay very close attention to having a non-judgmental attitude. We want to offer compassion and help, be familiar with resources, whether that's through your EAP. EAPs are just a natural link to pull in these kinds of conversations and situations. And then follow up, I'll mention a couple times as well. It's critically important that we set the stage for following up with our employees. It sets a natural ability for us to, if things are going really well, to build on that, and if they're not going so well, to really address those again, or somewhere in between. So basically what we really want to do is show diligence in addressing issues, really show some compassion in offering support, and an openness to providing an opportunity to improve the situation, and that means including the employee as well, obviously. So some some signs of impairment. I'm going to talk about a few areas here. I know some of my colleagues are going to talk about more a little bit in a few minutes. So if we look at attendance in particular, some things that might come up, someone might be arriving late, leaving early, having unexplained absences. And remember, especially if it's a change in behavior from what we know that they've exhibited in the past, inconsistent attendance. General behavior might include things like overreacting, avoiding coworkers, complaining about not feeling well generally, exaggerated work accomplishments, some grandiosity, and becoming undependable. And again, just watching for a shift or change from past behavior, difficulty adjusting to changes in the workplace. Related to job performance, some ideas that come up might be missed deadlines, a decrease in efficiency, poor judgment or lack of concentration, performing far below expected levels. So as you won't be surprised, the signs listed here may not necessarily mean an employee has a substance abuse or mental illness problem. We need to be extremely careful when we're moving in this direction. For example, if someone comes in with slurred speech, which is one of the things we might watch for, it certainly could mean they're under the influence, or it may mean that they need insulin, or it may mean that they're having a stroke. So we need to be extremely cautious moving forward. Some things to think about when we're evaluating a situation is review the entire picture. Be extremely careful about assumptions. Do we see more than one sign? Have several incidences occurred over time? What's the impact? What's different? Is there a progression in signs displayed? And then talking about effective conversations, here's a natural next step. And again, we are generally not taught how to do this. So, and oftentimes, thinking ahead will be our best bet and plan. So we want to plan what to say. If we're not sure what to say, it's review it with your supervisor or review it with HR. Develop an agenda. Really know going in ahead of time what you're going to say. What happens if we don't? Lots of things fall out around the edges. Sometimes we don't get to where we need to be. Sometimes our opening statement will be like 3 minutes long when it should be very concise. So we'll develop agenda, we'll decide on how to conduct the meeting. Are we going to do it privately? Are we going to do it with other supervisors? And we want to describe factual observations with specific examples based on behaviors. We're going to be respectful. It will be confidential. That's critically important. And one of the ways that we think about it when we're working through with folks is, how would you want to be treated? Or someone that you care about, how would you want them to be treated in situations like this? Address behavior in a timely manner. Stay focused on the behavior. And also, it doesn't get easier the longer that we wait. And oftentimes, the problem does not go away. So we want to emphasize need for improved performance. Give expectations. Be very clear about what's expected. Explain actions that may be taken if performance does not improve. And again, here's that reminder about following up. Set the stage right now for a follow-up meeting. Lots of good things can come from that. So we want to develop a plan and include the expected performance improvements. It should be clear. They should be clearly written. If it's a job performance issue that we're discussing, we can relate it right back to the job description. And we really want employees part of this process and give input on how it might get better. That's where we get our buy-in. So why do we not have these types of conversations? Because they're really hard, and again, we really haven't oftentimes been trained to do it. I'll say again, it generally doesn't get better if we don't have appropriate conversations. Employees generally don't receive the support that they need. Strained relationships often will come out of it. Coworkers will often feel a responsibility to take on more responsibility or cover for the individuals, and this often will lead to anger and resentment at some point in the future related to the employees or who are picking up this extra work. Often a decrease in morale and an increase in absenteeism. So here are a couple of things that to review. So what if an employee tells a coworker, I might as well give up or not be here? So if we're really concerned about a safety issue, we need to take this immediately and move on it. Some employees will bring them in, a supervisor will bring them in, and they might say, oh, I received this bad information, or something's happening with my job, and it was just something that kind of blurted out. And so that conversation can happen. Oftentimes, we'll get called in at this point and really assess, is there really a safety issue? We might talk to the employee on the phone. We might make an appointment for them to come in, but very clear that it's certainly not something that we would gloss over. And an employee comes to work intoxicated. So clearly, we cannot have people at work intoxicated. So pulling that employee off duty and having a conversation about the policies and procedures related to substance abuse at work will be critically important. If you hear someone has a problem outside of work, if it's not impacting their job performance, it's really not an issue that we're going to call an employee in about. Or you begin to deal with a job performance issue and the employee tells us that there's a disability. I'll caution you around this is that, be careful about automatic assumptions. It may be that it's a reaction to having the conversation, or it really may be that there is something going on for the employee and they haven't, for whatever reason, brought it up until now. It just hasn't come to the surface for lots of reasons. So listen and just be careful about assumptions. Also, if through this process an accommodation is requested, start that process immediately and work with folks who really know the rules around that, whether that's a supervisor or your HR department. There are very specific steps that can be taken, that need to be taken. So what is not my role? Which is as critically important as what my role is. Ignoring the problem creates all kinds of issues. Enabling the problem, being vague, offering diagnosis, and providing counseling. So a couple of examples. Enabling is really easy to do, and we don't mean to enable. We're just trying to be helpful. I've worked with folks in the past who an employee who's having a hard time to get into work for multiple reasons, but all of a sudden it ended up being that the supervisor was calling and getting the employee out of bed to get them into work on time. Also, backing off or lightening up is often not helpful either. Really addressing the issue at hand is really the best way to go. Obviously, offering a diagnosis is not okay. And then providing counseling, this is a really squishy one because, we talk to employees because we care about them and we want things to go okay, and we have difficult conversations, but we have to be really good at offering appropriate resources. And when it starts really feeling like, uh-oh, I really opened up a can of worms here, it's really okay to say, I really care about you. I want to make sure that we are helping in the best way that we can. And that's a great time to call EAP. Here are 3 areas to be cautious about. Stigma, attitude, and assumptions. Consider our own and others' attitudes about employees who are struggling. We are going to set the example around this. What are we going to support? What are we going to tolerate? How are we going to address these issues if they're not going in the best way possible? Employees will look to us to set the stage and the culture around this. I was reading some stats, and it noted that 57% of all adults believe that people are caring and sympathetic to individuals who have mental illness. So 57% of all adults believe that. 25% of adults who were experiencing mental health symptoms believed that to be the case. So just something to keep in mind, differences in perspective, and for us to keep in mind as we move forward. So we always want to be considering how our current organizational policies and culture are related to mental health and substance abuse issues. So let's see. Mental illness is nothing to be ashamed of, but stigma and bias shame us all. So again, remember, we are setting the stage. So let's take a quick review of what works. What we know to work. There are lots and lots of things that work, but we'll tackle a couple of things here. Provide information and train supervisors. It's critically important. Be familiar with and offer resources. place information in break rooms. So what we don't want to do is if an issue comes up with an employee, and it's kind of, you know, I mean, sometimes we work in small places, and even though we're holding confidence, doesn't mean that sometimes information gets talked about. What we don't want to do is have it all of a sudden, if a particular issue is being discussed, all of a sudden all these brochures and information goes up around our facility. So let's try to get it in at orientation and have it be a natural piece of what we're doing and how we handle things through our organization. So in short, employees have access to services. If we can be proactive around that and have employees know what is available for them, when something comes up, they're much more likely to reach out, and it's just a natural process of support rather than a reaction. And then workplace health promotion programs are useful. Engagement surveys where we can ask employees what's going well and highlight what improvements might be made. And of course, there's EAP. So active EAPs, we know, are one of the most effective ways to support employees with all kinds of issues by offering counseling and referral. And employee assistance programs can really dig into those issues that really can't be addressed, those personal issues that really can't be addressed in the meeting with the supervisor, per se. So in summary, be aware, move quickly, and tread lightly. Intervene early and supportively. Equip managers and supervisors with skills and tools to have effective communications with employees. Recognize signs, address issues, offer compassion and help. Take action, talk, listen, maintain regular contact, document, and be respectful. And also remember, be familiar with your policies and procedures and make sure that you can articulate them to your employees. And if you're not sure, team up with folks who can support you to make sure you're doing a great job for not only your employees, but for your employer all the way around. Okay, thank you.
Sheila, thank you. That was wonderful. Really appreciate it. And I know you'll be hanging on for questions, and I'll just remind people now that at any point in time, you can type your questions into the chat box at the bottom of your screen, and we will review them at the end. But right now, I'm going to move forward with our next presenters from Maine Behavioral Healthcare. Dennis King is the Chief Executive Officer of Maine Behavioral Healthcare, the nonprofit integrated mental health care delivery system of Maine Health. From 1999 to February 2015, he served as the founding CEO of Spring Harbor Hospital in Westbrook. Mr. King brings to his current role more than 35 years of experience in the field of healthcare, including more than 30 years in senior administrative positions in Maine hospitals. He was previously the founding Chief Executive Officer of the Acadia Hospital, the only freestanding private psychiatric hospital in northern Maine. Mr. King is the past president of the National Association of Psychiatric Healthcare Systems, past chair of the Maine Hospital Association, and past chair of the Board of Trustees of the Maine Community College System. Mr. King was also the charter president of Casco Bay Sunrise Rotary Club. He earned a Master of Public Administration degree from the University of Maine and is a fellow in the American College of Healthcare Executives. Joining him today is Melania Turgelsky, and she combines clinical depth with extensive management experience over 2 decades in the mental and behavioral health fields. She has held various clinical and administrative positions, including residential inpatient and outpatient therapist, director of child and family counseling services, director of special projects, vice president of quality and strategic initiatives, vice president of operations, chief operating officer, and most recently, vice president of quality and performance improvement at Maine Behavioral Healthcare, an organization serving nearly 20,000 patients in over 30 sites. She has particular interest in dialectical behavior therapy, trauma, and family work. Her experience administering clinical integration and early intervention programs round out her interest in treatment modalities. A childhood spent in Kenya and Nigeria influences her perspective on life and work. She attended Yale University and obtained her master's from Smith College School for Social Work. She is an active member of her community, volunteering annually for the Beach to Beacon Road Race, the Multiracial Adoptive Family Collaborative, and other community organizations. So we are very pleased right now to pass the controls over to both of these speakers, and know you'll enjoy what they have to say.
So anyway, what we want to do, I think Sheila very well set the stage in terms of what we are going to talk about here today. We're going to focus more on the prevention and early intervention side of it. And I'm always told by colleagues that I should I should always give a proper credit to where it's due. And we're working on getting the slides going here. Bear with us. Our slides are not advancing. Okay. Okay, to always focus on the importance of work, and nobody expresses it better than Sigmund Freud, who says no other technique for the conduct of life attaches the individual so firmly to reality as laying the emphasis on work. For his work at least gives him a secure place in a portion of reality and in the human community. So I think that's worth pausing on in how we connect the importance of keeping people healthy at work to the extent that we can. Okay, so we go to the next slide. First of all, just to real quickly, who is Maine Behavioral Healthcare? You would have known us by a number of other names in the past, but we are an organization that came together 1 year ago through a merger of 5 organizations, and it includes Spring Harbor Hospital, which is not, as we state here, Maine's only private nonprofit psychiatric hospital, but rather the only one in southern Maine. We serve nearly 20,000 clients and patients, and we have a large service area of over 30 locations, and we are the only behavioral health care organization in Maine to offer the complete spectrum of integrated care in our service area. We also value and have had great experience over the past 20 years, really, through a partnership with Maine Medical Center in providing work counseling for adults and youth who deal with special issues in the workforce, and it is very important to us to maintain that. We believe as well that work is self-defining, and that families often face the burden of being, quote-unquote, the shadow mental health system, and therefore they need support, and work often provides that structure that is needed. We have received foundation support just very recently for a program to help people with mental illness meet employment goals at the time of hospitalization. And we know that each situation is different, but one constant remains, and that is families do not have to face the uncertainty and anxiety of a loved one's mental health crisis alone, and connecting back with the community through the world of work is often the best way to facilitate that. We have experience as well as an employee assistance program provider. Our Lancaster Street location in Portland has been an EAP provider for over 20 years. We have experience with national, regional, and local contracts serving Maine citizens, and we offer assessments, brief counseling, and crisis intervention to employers, as well as organizational training and HR support. We serve local organizations and companies, school systems, and municipalities with between 30 and 1,200 employees. We know that investment in mental health pays off, and I think Sheila mentioned very clearly the reduces work absenteeism, unnecessary doctor visits, and healthcare expenditures. It maximizes the workplace performance, strengthens positive and productive work environments, of course reduces stigma, which is an important thing that hopefully we see some change in these days, fosters recovery and resiliency, and we know that not everyone wants but may need formal intervention, and that elevates this matter to a great importance, and we leave that to professionals to help us with. And at this point, I'm going to turn it over to a professional who's had a great deal of experience, Melania.
Thank you, Dennis. So as Sheila discussed earlier, the costs to employers are tremendous. We know that approximately $104 billion is lost to employers across the country due to direct costs related to mental illness and substance abuse, particularly when it is not treated. We know that hundreds of millions of workdays are lost each year as mental illness impacts employees and their family members. As Sheila mentioned, there are a large number of people who experience mental health disorders, and just think about the fact that potentially 1 in 20 of your adult employees may experience a major depressive disorder in a given year. It is so debilitating to have an experience like that it's almost impossible to maintain your usual productivity at work. And so, of course, the employer is going to both feel for that employee, but also see increased disability claims, lost productivity, and other additional costs. Again, as mentioned by the previous speakers, it's vital for the employer to recognize how important it is to support mental health, to provide prevention education on mental health and substance abuse for managers and staff, as Sheila discussed, so that you may address presenteeism, as was discussed, and absenteeism, because as you all know, that when you have an employee who is sitting at the desk but not necessarily working up to your expectations, it impacts both the business as well as all of the other employees around them. What we want to help employers understand is there are two broad buckets to address in terms of mental health in the workplace. One is the stressful and traumatic events that happen as a course of life, that happen to all employees. And then the other is the broad range of illnesses that impact employees and families that require specialty intervention. Depression and anxiety are probably the most widespread, but there are other very serious diagnoses, which we'll talk about a little bit as well, such as schizophrenia. So let's first talk about that first bucket. We know that stressful events happen to everybody. I would assume that everybody listening today knows somebody who in their family has been lost to an illness or a natural death, has been in a car accident, may have experienced divorce or a major illness in the family, and some folks have experienced more problematic events in their families as well, which they may be quite private about, such as violence at home. And then, of course, in the workplace, the more routine workplace performance issues that come up for adults and for children, issues that happen in school. Now, some of the stressful events that occur are just that. They're stressful, and people get through them. And in fact, even extremely stressful events are often resolved by an individual without seeking professional help. But let's take a look at the prevalence for a moment. We know that in the U.S., post-traumatic stress disorder, which is an illness where most commonly you'll see symptoms of memory loss, loss of interest in activities, feeling detached from sort of the routines and loved ones in one's life, sleep and concentration problems, irritability, and sometimes even loss of control of behavior, may happen to a huge number of our friends, our family, our neighbors, and our fellow employees. We know that potentially up to half of people actually have a post-traumatic response to a motor vehicle accident. Even though a person may not be killed or badly injured, the body responds knowing that a near-death or potentially deadly occurrence has happened, and people sometimes really struggle to get over that. Certainly there are other much more dramatic events as listed here, but we know that, that not only are these happening to everybody who we may work with. But in addition, we know that providers, nurses and doctors are often traumatized themselves by working with families that are in anguish as they are going through the medical care or aftermath of a terrible incident in terms of mental health support. So let's take a moment to talk about that natural resiliency that people have. In fact, it's so interesting because most people, even when they have a terribly traumatic event, actually have internal mechanisms that kick in and they begin to recover. It particularly happens when they have a close-knit family or network of support around them. This is one example where, even though it's certainly not the employer's job to help someone get over a post-traumatic stress response, a friendly and supportive workplace is one more element to helping people get better. So as you can see in this graph, most people following an event will have a period of just a few weeks where they transition, and at least half of people tend to just bounce back right away. However, there will be some number of people who take months to get over that initial stress and reaction to the event. And then for some, it may take years or even decades, or in fact, they would never get over it without intervention. Now, the point of intervention, and early intervention, is to move as many people as possible closer to the left-hand side of that graph. You want to see people getting over it and getting back to their previous level of functioning as quickly as possible. So again, as Sheila said, provider education is incredibly useful and important. Teaching people to recognize early warning signs not only in themselves, but also in their children and in others around them is a very useful way to head this issue off and to help people quickly identify if there is a problem that would benefit from more formal intervention. There are a few specific factors that relate to development of PTSD, as we call it in shorthand, post-traumatic stress disorder. And this comes from when people have a traumatic event that may seem manageable, but then find that if there are several different events in succession, they have a combined impact. So for example, I know of a case where a child was going through a difficult divorce and there was some acrimony between the parents. The child was doing okay, but having some struggles. Then there was a car accident, and after that occurred, the child refused to leave the house. Now you can imagine what this meant in terms of the parents' concern for their child, but also in terms of their work life. These were folks who went to work every day and needed to be at a job from 9 to 5, and they had a child who wouldn't go to school. And so clearly they had to take time off to get through this. This is one example of how one's personality and other instances will impact the course of development of symptoms for an individual. One more point that I want to make is to talk a little bit about critical incidents. There are many examples, and unfortunately, as we have experienced in the last decade or so, more and more incidents where large numbers of people may be impacted by an event. This model tended to be developed through discussion of natural disasters, but as terrorism has become more widespread, people have come to understand that all sorts of different kinds of incidents fall into this model. So the example you see here is following a natural disaster, but this could occur with any kind of widespread event that people learn about. As you can imagine, the people in the center, where it says A, might be the individuals who were directly impacted and following an event after medical care. Those individuals might need intensive counseling to help them get through it. But what we've come to understand is that as you go through the different levels, all the way to level E, the people who presumably had no direct impact at all by that event, we find that in fact they do. And this is where employers come in. I'm going to give you a really interesting example. In 1995, you may recall that terrorists released sarin gas in the Tokyo subway. In that event, 12 people were killed, 200 were harmed by the gas, but 5,500 people presented at hospital emergency rooms for care. Most of those individuals had no direct impact whatsoever, but they felt that they did. And what it taught us is that everybody is impacted by these events. And so it brings us back to the idea that attending to the large group will help to allow us to use resources better and to take care of those individuals so that they can, again, get back to their previous level of functioning. An example that is much closer to home but uses the same conceptualization is when you have a layoff in an employer at an organization, or a workplace event. Let's say a beloved employee dies in an accident or develops a terminal illness. Providing some sort of treatment to impact the group is very, very useful, and often will help individuals get a hold of difficult material so that it doesn't impact them over time. Finally, I want to talk a little bit about the other bucket, which is the more serious mental health issues. These statistics represent Maine itself. And what we know is that 17% of Maine adults reported excessive drinking from, this is actually Maine Health Management Coalition data. And similarly, 38% of adults reported that they had had some difficulty with mental health in the past month. So we know that not only do people experience stress, many of our friends and neighbors also experience mental health and substance abuse issues. I will take us to an example in which we look at the burden of mental illness on a family and on an employer. One example are children with anxiety. It's very, very common. As you look at this graph, you'll see that perhaps about 5% of children have extreme emotional impairment with an anxiety disorder. 10% may have some sort of impairment, but up to 20% have some sort of behavioral problem that needs to be addressed and actually qualifies for diagnosis. Families coping with these issues juggle work and family commitments. We know that they lose work time every month and need to leave early to support their children in getting appropriate care. Again, if this isn't acknowledged in the workplace, it can lead to termination of employment, which of course costs a great deal of money and leads to a whole host of other issues. Finally, I would just add that there are certainly times when there are very serious problems, and as Sheila discussed, there are going to be examples where if someone appears to have an immediate threat of harm, it's very important to address it right away, to help them get help right away. This is something where if you're really concerned about somebody, don't be afraid to reach out. So, in summary, it's extremely helpful for the employer to think about insurance benefits design, to ask your insurer whether they cover certain treatments that you feel would be helpful to your employees, to think about flexible policies and workplace practices that support families knowing how widespread these issues are so that they can maintain their employment and continue to be as productive as possible for the employer. Thank you very much.
Thank you so much, Dennis and Melania, and of course, Sheila, you were all terrific, and we appreciate it so much. I will open it up for questions here in just a second, but I just want to make you aware that you'll receive a post-webinar survey, and please do fill it out so that we can help provide you with the best quality webinars for you. So our first question, I will kind of leave this up to whoever feels they're best equipped to answer. There's a high incidence of duplicity and multiplicity of comorbid conditions that have addictive impacts on employees. An example is obesity, which has a high overlap with dyslexia, hypertension, diabetes, and depression. What steps do you propose to address this chronic multiplicity of medical issues? Whichever one of you wants to take that question, that would be great.
Sure. Well, I think that again, when you have a multiplicity of issues, you need a multiplicity of people helping to be part of the solution. There are many, many different players that come together, and in fact, I think the Maine Health Management Coalition is an excellent example of bringing payers, providers, consumers, and employers together to talk about what the issues are that need to be addressed and what the best ways are to support them. Obesity is an excellent example of something which has a tremendous impact on many other health issues, and as the questioner pointed out, is comorbid with other issues. And so the first piece is to have some collaborative work in terms of designing an approach.
Okay, thank you. What do you do if you suspect a mental illness or substance abuse problem? Can you initiate your concerns with that person? And if so, how would you go about that? Sheila, do you want to take that one?
Yeah, sure. Can you hear me okay?
Yep.
Okay. Well, I think first of all, we really need to, you can have the conversation, and you know, if the issues are coming up as performance related, of course you can start there. But you want to really look at the specific behaviors that are coming across, and use very specific measurable terms to address them. So what we don't want to do, if we believe that if someone's coming to work and someone's smelling alcohol on them and we're getting a report of that, then what we don't want to say is, well, can you please come in? I think you have an alcohol problem. What we really want to do is we want to be very clear. This is our concern. We've gotten 4 reports that whenever you've come in the morning that some individuals have smelled alcohol on your breath, and you take the opportunity to really talk about what the next steps might be, or give them an opportunity to engage in that conversation, and then and then depending upon how that piece goes, if the person absolutely denies that part, you have an opportunity to really monitor over time. So we want to be very clear about the behavior, but we do need to have the conversation.
Okay, great, thank you. Here's another one. What statistics might you have that show improvement in absenteeism and performance after training and EAP? And I guess to coincide with that, they've added, what does the post-training and EAP look like in terms of healthcare savings?
That's a great question, and I think that it's absolutely legitimate for us to be held responsible, not simply to say intervention is a great idea, but to actually do some work to prove that it saves money. We know that there have been a number of studies, and we can send out some various links to folks afterwards if they're interested, but the Department of Labor, the Substance Abuse Mental Health Services Administration at the federal level, and the National Business Group on Health have all done a lot of work on these issues. For example, we know that work loss after intervention, such as an EAP or mental health intervention, was reduced by an average of 60% once people received treatment. And people found that productivity in another study increased by an average of 43% for almost 75% of the staff or employees that received intervention. Similarly, in terms of health savings, we know that in one study, there was a 75% reduction in inpatient substance abuse treatment when outpatient substance abuse treatment was provided. And as you can imagine, outpatient substance abuse treatment is much, much cheaper. In addition, there was a 33% reduction in use of sickness benefits after mental health intervention or EAP services were provided.
So that's some pretty strong statistics to back up getting the services that are needed. What steps can you take to ensure confidentiality to make a person comfortable to seek help? And so how would you go about creating a trusting environment?
Well, you know, I think, first of all, we need to be upfront and again, talking about especially at orientation, and giving as much information about who we are as an employer, what folks can expect. And the reality is, you know, if it's a safety issue, the confidentiality piece is going to look very, very different. For example, we had a situation where someone recently broke a no trespassing policy that had been just set up. We ended up sending out information to all of our employees, not giving specifics about that particular incident, not of names or anything of that nature, but it was a safety issue related to what people could expect, if there were going to be changes when they came to the door, if it was going to be locked, if there was going to be a security person there. So again, we're not going to talk about specifics, but depending upon what the situation is, will determine some of that confidentiality piece. And related to trust, you know, it's really about doing what we say we're going to do and following through. And some of those pieces that I had talked about, you know, earlier around, you know, training folks, following through, being upfront if we have to make difficult changes. Having confidence in what you're doing. And if you're not understanding how to do it, get the training on it and show that you're competent in those areas. And mainly, being compassionate and doing what you say you're going to do.
I see. Okay. Is there a certain point when you would recognize when to recommend bringing in outside expertise, or, you know, what would you do if you suspect a dangerous situation?
A dangerous situation? Well, it depends on what kind. I mean, if it's a safety issue related to someone saying they're going to hurt themselves, then of course you can quickly bring in EAP. Or if it's a dangerous situation where someone, you know, someone might be concerned people would come with and hurt other people, we should really know our policies and procedures around that. We had a situation in one of our employees' places of work where a threat was made to come in and shoot people up. So we immediately went to our policies and procedures and put steps in place and talked with staff about how we were following our policy and procedure, how we planned on keeping people safe, and we followed that procedure right down the line.
I see. Okay. I think we have time for one last question, and then we're really out of time, and you know, anybody can jump in and answer it. But can you provide any kind of estimate on the cost range for employee assistance programs?
Well, we could probably both answer. They range tremendously. Some models have what's called a per employee per month cost, and others charge just by the actual intervention. So for example, our program charges by the intervention. So there's only a charge when an employee actually utilizes a face-to-face session or requires an office requires on-the-ground intervention. But other models function differently.
Yeah, the larger national providers, for example, go on the PM per month, like Ceridian and some of the other ones.
We actually do a combination. We'll do a full service EAP where we will take lots of things into account, such as what we believe utilization might be, the type of organization, the location, the number of employees, what the cost will be for us, and then we also do the fee for service kind of model as well. So it ranges pretty broadly depending upon what folks are looking for and how if it's a full service EAP or not.
Well, I want to just extend a huge thank you to all our speakers today for such an excellent job and such great information, and remind the attendees to please do respond to the survey after the webinar so we can provide you with more good webinars. So thank you, and have a great afternoon, everybody.
Thank you.
Thanks.
Bye-bye.